In the sterile corridors of St. Mary's Medical Center, a graying veteran was about to face his most humiliating defeat. What started as a routine consultation for life-saving heart surgery took a shocking turn when he came face to face with a surgeon who saw him as worthless. Robert "Tank" Morrison wasn't your typical homeless drifter. For 30 years, he had spent his life completing classified missions that officially never existed. When he encountered Dr. Crawford's cold dismissal, he had no idea a CIA declassification would soon expose the truth. What began as medical discrimination would become a reckoning with America's forgotten heroes. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. The autumn rain hammered against the windows of Massachusetts General Hospital's cardiac wing as Dr. Sarah Mitchell adjusted her surgical mask and stepped away from the monitors displaying Jake Morrison's vital signs. The numbers told a story she'd seen countless times before. Massive myocardial infarction, extensive damage to the left anterior descending artery, ejection fraction dropping below 30%. What they didn't tell her was why she should care about saving this particular life. Jake lay unconscious on the examination table, his weathered face partially obscured by an oxygen mask that fogged with each labored breath. The smell of unwashed clothes and alcohol hung in the air despite the room's aggressive ventilation system. His grey beard was matted, his fingernails caked with dirt, and his jacket, military surplus from decades past, bore stains that spoke of months spent sleeping rough on Boston's unforgiving streets. Classic presentation of acute coronary syndrome, Sarah murmured to Dr. Jennifer Walsh, her third-year resident, who stood beside her reviewing the EKG strips. Extensive anterior wall MI with ST elevation. He'll need immediate surgical revascularization, triple, bypass, possibly 4 vessels, depending on what we find. Jennifer nodded, her young face serious with concentration. His troponin levels are through the roof. How long do we have? Hours, maybe less. Sarah's voice carried the clinical detachment that had made her one of the most sought-after cardiac surgeons on the East Coast. She'd built her reputation on precision, excellence, and an unwavering commitment to achieving perfect outcomes for patients who deserved them. The ER doors burst open as Nurse Patricia Rodriguez entered, her scrubs still damp from the rain and her expression grim. Pat had been working the night shift when the paramedics brought Jake in, found collapsed outside a downtown shelter, his pulse barely detectable. "Dr. Mitchell, we need to get him to the OR, Pat said, checking the IV drip that was keeping Jake's blood pressure stable, his conditions deteriorating. Sarah pulled up Jake's electronic medical record on the tablet, her perfectly manicured fingers scrolling through the sparse information. What she found there confirmed her growing reluctance to take this case. Mr. Morrison, age 52, homeless, history of chronic alcoholism with multiple detox admissions. She read the notes aloud, her tone growing colder with each detail. No insurance, no emergency contacts, no permanent address. Previous admissions for alcohol-related incidents, including a DUI arrest 3 years ago. Jennifer shifted uncomfortably. Dr. Mitchell, his heart condition is entirely self-inflicted, Sarah cut her off. Years of alcohol abuse, poor diet, smoking, complete disregard for his health. This is the inevitable result of lifestyle. Choices. Pat's eyes flashed with something dangerous. He's a veteran, doctor. He served our country. That doesn't change his medical history or his current status. Sarah's voice carried the authority of someone accustomed to having her. Decisions go unquestioned. We have limited resources, limited OR time. I have 3 other cases scheduled tomorrow. A city councilman needing valve replacement, a university professor with familial cardiomyopathy, a mother of 4 with congenital defects, people with lives worth saving. The words hung in the air like a toxic cloud. Jennifer's face went pale, while Pat's hands clenched into fists at her sides. "Worth saving." Pat's voice was barely controlled. "Who are you to decide whose life is worth?" Sarah felt her chest tighten, the familiar sensation that came whenever someone questioned her judgment. She'd clawed her way out of a small Ohio town where her father drank himself to death, fought through medical school on scholarships and determination, and built a practice that commanded respect from Boston's elite. She didn't make decisions lightly, and she certainly didn't make them based on sentimentality. "I make decisions based on medical ethics and resource allocation," she replied, her tone growing sharper. "This man has no family, no support system, and a documented history of non-compliance with medical treatment. Even if we save him today, he'll be back on the streets tomorrow, drinking himself toward the next cardiac event. Meanwhile, my other patients, productive members of society, wait for surgery that could give them decades of meaningful life." Dr. Marcus Webb appeared in the doorway, his silver hair perfectly styled despite the late hour. As chief of staff, he commanded the same respect that Sarah did in the surgical suite, a respect built on decades of navigating the complex politics of hospital administration. "Sarah, what's the status on our John Doe?" "Jake Morrison," Pat corrected firmly. "His name is Jake Morrison, and he needs immediate cardiac surgery." Sarah turned to her mentor, grateful for his arrival. "Dr. Webb, Mr. Morrison presents with extensive coronary artery disease requiring triple bypass. However, given his social circumstances and medical history, I don't believe he's an appropriate candidate for our surgical program." Webb's expression remained neutral, but Sarah caught the slight nod that indicated his understanding. They'd had this conversation before, not about specific patients, but about the broader philosophy of medical resource allocation. MGH was a teaching hospital, yes, but it was also a business that couldn't afford to hemorrhage money on hopeless cases. "What's your recommendation?" Webb asked. "Transfer to City Hospital. They're better equipped to handle charity cases." Sarah's words were clinically precise, professionally delivered, and utterly devastating in their implications. Jennifer stepped forward, her voice trembling slightly. "Dr. Mitchell, with respect, City Hospital doesn't have cardiac surgery capability. If we transfer him, he'll die. And if we operate on him here, we're taking resources away from patients with better prognoses," Sarah replied without hesitation. "It's basic triage, Dr. Walsh. Medical school should have taught you that we can't save everyone." Pat moved closer to Jake's bedside, her protective instincts fully engaged. "This man collapsed outside our doors. That makes him our responsibility." "No," Sarah said firmly. "It makes him an emergency stabilization case. We've done our duty by getting him stable for transport." The monitors continued their steady beeping, Jake's heart struggling against the damage that decades of untreated trauma, both physical and psychological, had inflicted. In his unconscious state, he seemed smaller, more vulnerable. The military, bearing that he carried even in his darkest moments, temporarily absent. Webb checked his watch, calculating the political implications of whatever decision they made. "Sarah, perhaps Dr. Walsh could take the case. Supervised, of course." Sarah's eyes narrowed. The suggestion felt like a challenge to her authority, a questioning of her medical judgment. "Dr. Walsh isn't ready for a case this complex. Triple bypass surgery requires a surgeon who believes the patient deserves to live," Jennifer said quietly, her words carrying a strength that surprised everyone in the room. The accusation hit Sarah like a physical blow. "How dare you question my—" Jake's eyes fluttered open, cutting through the argument with unexpected clarity. Despite the medication, despite the pain, despite the fog of alcohol withdrawal, his gaze was sharp, intelligent, aware. He looked around the room, taking in the tension, the angry faces, the monitors displaying his failing heart. "Ma'am," he said to Sarah, his voice rough but steady, "I can hear what you're saying. His accent carried hints of rural Tennessee, but his words were articulate, precise. "I understand you don't think I'm worth saving." Sarah felt something twist in her chest, not medical, but emotional, something she'd spent years learning to suppress. "Mr. Morrison, you're not... I'm not what?" Jake's eyes held hers, and, for a moment, she saw something there that didn't match her assumptions. Intelligence, dignity, pain that went deeper than any physical ailment. "Not worth your time, not worth your skills. I've heard it before, Doctor, but never from someone who took an oath to do no harm." The words hung in the air, like an indictment. Sarah felt the eyes of her colleagues upon her, felt the weight of judgment she'd spent her career avoiding. But beneath their scrutiny lay something worse, the uncomfortable recognition that maybe, just maybe, her perfect professional life was built on a foundation that was anything but perfect. Jake's eyes closed again as the medication pulled him back under, but his words echoed in the sudden silence. Pat checked his vitals with gentle efficiency, while Jennifer stood frozen between her training and her conscience. Dr. Webb waited for Sarah's final decision, his expression unreadable. Sarah looked down at the man whose life hung in the balance, whose worth she'd dismissed with clinical precision. Something about his bearing, even unconscious, suggested depths she hadn't bothered to explore. But it was too late now. She'd made her position clear, staked her reputation on it. "Dr. Walsh," she said finally, her voice steady despite the turmoil in her chest. "Consider this a teaching case. You'll assist Dr. Patterson from surgery when he arrives for his morning shift, if Mr. Morrison survives until then." As she walked toward the door, Sarah caught Pat Rodriguez's expression, disappointment mixed, with something that looked dangerously like disgust. Behind her, she could hear Jennifer frantically calling for additional support, Pat coordinating care with the efficiency of someone determined to prove that every life had value. The sound of Jake's labored breathing followed Sarah down the corridor, a rhythm that would haunt her long after she thought she'd left this case behind. She'd made the right decision. The practical decision, the decision that preserved resources for patients who could truly benefit from them. So why did it feel like the worst mistake of her professional life? The sound of Jake's labored breathing followed Sarah down the corridor, each rasp a reminder of the decision she'd just made. She moved with practiced efficiency toward her office, her heels clicking against the polished linoleum in a rhythm that matched her racing pulse. The familiar weight of her stethoscope around her neck felt heavier somehow, as if the instrument that had guided her through countless life-saving procedures now questioned her judgment. Sarah's office occupied a corner of the cardiac wing, its floor-to-ceiling windows offering a commanding view of Boston's skyline. The space was a testament to her success: leather-bound medical journals, awards from prestigious surgical societies, photographs of her with senators and celebrities, whose hearts she'd repaired. Everything spoke of excellence, of a life built on the foundation of saving those who mattered. She closed the door and leaned against it, trying to shake the image of Jake Morrison's eyes. Those weren't the eyes of a worthless drunk. They'd held intelligence, awareness, and something else, a depth of pain that mirrored her own. "I understand you don't think I'm worth saving." The words echoed in her memory as she walked to her desk, past the framed diploma from Johns Hopkins, past the photograph of her receiving the American Heart Association's Young Investigator Award. But it was another photograph, smaller and tucked behind the others, that drew her attention now. 12-year-old Sarah Mitchell stared back at her from the faded image, her face serious beyond her years, as she stood beside a man whose eyes already showed the hollow look of advanced alcoholism. David Mitchell had been a good man once, a factory worker who'd taught his daughter to fish, who'd read her bedtime stories, who'd dreamed of better things for his family. But the bottle had taken him piece by piece, until only the shell remained. Sarah remembered the morning she'd found him. She'd gotten up early to study for a math test, proud of the A's that were her ticket out of their small Ohio town. The house had been too quiet, the kind of silence that makes a child's instincts scream warnings. She'd found him in his chair, empty bourbon bottle at his feet, his lips already blue with death. The paramedics had been kind but clinical. Alcohol poisoning, they'd explained to her grandmother, who'd arrived still in her church dress to collect the newly orphaned girl. His liver finally gave out, nothing anyone could have done. But Sarah had known better. There were things that could have been done: rehab, intervention, medical treatment. Her father had chosen the bottle instead, chosen his addiction over his daughter's future, over his own life. Standing in that small living room, surrounded by the detritus of a wasted existence, 12-year-old Sarah had made a vow. She would never be powerless against death again, and she would never waste her gifts on those who chose to waste their lives. A soft knock on her office door pulled her from the memory. "Come in!" Dr. Jennifer Walsh entered, her young face pale but determined. "Dr. Mitchell, I wanted to update you on Mr. Morrison's condition." Sarah didn't look up from her computer screen, where she was reviewing tomorrow's surgical schedule. "As I said, Dr. Walsh, he's your patient now. I don't need updates." "His vitals have stabilized slightly. Nurse Rodriguez managed to get more information from the paramedics." Jennifer's voice carried a note of something Sarah couldn't quite identify. "They found military dog tags on him, old ones from the 1990s. Many homeless veterans have dog tags, Doctor. It doesn't change his current circumstances." Jennifer stepped closer to the desk. There was something else. He was protecting another homeless man when he collapsed, an elderly veteran who was being robbed. The paramedic said Mr. Morrison fought off 3 attackers before his heart gave out. Sarah's fingers paused over the keyboard. That was foolish. In his condition, any physical exertion could have triggered the cardiac event. "Or maybe," Jennifer said quietly, "it shows that there's more to him than what appears in his medical file." The words hung between them, a challenge wrapped in professional courtesy. Sarah finally looked up, meeting her resident's gaze. "Dr. Walsh, let me give you some advice that will serve you well in your career. Don't let sentiment cloud your medical judgment. We are surgeons, not social workers. Our job is to save lives that can be saved, not to chase fairy tales about homeless heroes." Down in the ICU, Jake Morrison drifted in and out of consciousness, his mind caught between the present and memories that refused to stay buried. The steady beep of monitors mixed with other sounds, helicopter rotors, gunfire, screams in languages he'd learned to understand through context rather than study. Somalia, 1993, the compound where 200 hostages waited for rescue or death. His team, Rodriguez, Williams, Chen, Martinez, moving through the darkness with the precision that came from months of training and years of trust. "Broken arrow," he mumbled, the words slipping out before he could stop them, the military code phrase that meant friendly forces were under attack and in danger of being overrun. He'd called it in that night when everything went wrong, when the mission turned from rescue to survival. Nurse Pat Rodriguez looked up from charting medication doses. She'd heard the phrase before, during her army service in Iraq. It wasn't something civilians typically knew, and it certainly wasn't something they said in their sleep. "Sir?" she said softly, checking his pupils with a penlight. "Mr. Morrison, can you hear me?" Jake's eyes opened, clearer now than they'd been in the ER. "Where am I?" "Massachusetts General Hospital. You had a heart attack. You're in the ICU." He tried to sit up, military training overriding medical weakness. "How long have I been here?" "About 3 hours. Sir, you need to—" "Stay calm. My heart's been broken for 30 years, nurse. Jake's voice carried a weariness that went beyond physical exhaustion. 3 hours more won't make much difference. Pat studied his face, noting the intelligence in his eyes, the way he'd automatically assessed his surroundings upon waking. This wasn't typical behavior for someone with chronic alcoholism and advanced heart disease. "The doctor wants to transfer you to City Hospital," she said carefully, watching his reaction. Jake's laugh was bitter. "Of course she does. Let me guess. I don't fit the demographic for this place's idea of a worthy patient. Dr. Mitchell is. She's very focused on certain types of cases." "Dr. Mitchell," Jake repeated, the name rolling around in his mouth like a curse. "Tell me, nurse, what would it take for someone like her to see someone like me as worth saving?" Pat checked his IV line, buying time to consider her answer. "I don't know, sir. I honestly don't know." Jake closed his eyes, feeling the familiar weight of invisible wounds that no surgery could repair. 30 years ago, I would have died for people like her. Hell, I nearly did. Lost my whole team making sure people could sleep safe in their beds, go to their fancy hospitals, live there, clean lives. Your military was military, Delta Force, but that was before I became this. He gestured weakly at his worn clothes, his unkempt appearance. Before I learned that some sacrifices don't buy you anything but nightmares and bottles to wash them down. Pat felt something shift in her understanding. "Sir, what unit? What years?" But Jake had drifted off again, the medication and exhaustion pulling him back under. Pat stood there for a long moment, studying his face and thinking about the incongruity between his appearance and his words. Delta Force operators didn't just disappear into homelessness. There were support systems, veteran services, recognition for elite soldiers. Unless something had gone wrong. Unless their service had been the kind that left no paper trail, no recognition, no support when the missions were over and the operators were left to carry the weight alone. She made a note in his chart about his military references, then walked to the nurses' station where Maria Santos, the hospital social worker, was reviewing cases for the night shift. "Maria, I need you to look into something. The homeless, veteran in bed 7, Jake Morrison. He's saying things that don't add up. Military things." Maria looked up from her paperwork, her dark eyes serious. "What kind of things?" "Delta Force, Broken Arrow, and the way he carries himself, even unconscious, even sick. There's something different about him." Maria nodded slowly. She'd worked with enough veterans to recognize the signs of hidden trauma, of service that went deeper than typical military experience. "I'll make some calls. If he really was Special Forces, there might be records, people who remember him." As the two women spoke in hushed tones about Jake Morrison's possible past, Sarah Mitchell sat in her office, staring at the photograph of her father and trying to understand why a homeless veteran's words had shattered the careful walls she'd built around her heart. Outside, Boston slept on, unaware that in one of its most prestigious hospitals, 3 lives were about to intersect in ways that would challenge everything they believed about worth, sacrifice, and the true meaning of healing. Dawn crept across Boston's skyline as Maria Santos pulled Jake Morrison's social services file from her computer, the fluorescent lights of the hospital's administrative wing casting harsh shadows across the sparse information. 3 emergency room visits in the past year, all alcohol-related. 2 stints in detox programs, both incomplete. No permanent address, no emergency contacts, no family listed. But it was what wasn't in the file that troubled her most. No military discharge papers, no VA records, no service-connected disability claims. For a man who claimed Delta Force service, Jake Morrison's official existence was remarkably thin. Maria's phone rang, interrupting her research. "Santos. It's Pat Rodriguez. I'm still with Morrison. He's been talking in his sleep. Military. Terminology. Operational language. And Maria, he knew what broken arrow meant. That's not something civilians pick up. Maria pulled up the VA database, typing in Jake's name and social security number. Nothing's coming up in the veteran records. No service history at all. That doesn't make sense. The way he carries himself, the things he's saying. This guy was military and not just regular army. I've seen enough special forces operators to recognize the signs. Through her office window, Maria could see the morning shift arriving. Doctors and nurses beginning another day of saving lives and making impossible decisions. Somewhere in the building, Dr. Sarah Mitchell was probably preparing for surgery, reviewing cases of patients she deemed worthy of her expertise. "I'll keep digging," Maria said. "But Pat, if this guy really was Black Ops, his records might be sealed or classified. We might never find the truth." 3 floors up, Dr. Jennifer Walsh was having her own crisis of conscience as she stood outside Jake Morrison's ICU room, watching the monitors that displayed his steadily weakening vital signs. She'd called Dr. Patterson twice, but the senior surgeon was stuck in traffic, and Jake's condition couldn't wait much longer. "Dr. Walsh." Nurse Pat Rodriguez emerged from Jake's room, her expression grim. "His blood pressure's dropping. We need to move soon, or we're going to lose him." Jennifer felt the weight of responsibility settling on her shoulders like a lead blanket. She'd assisted on dozens of cardiac surgeries, but never as the primary surgeon, never with a patient whose life hung by such a thin thread. "Has Dr. Mitchell changed her position?" Pat's expression hardened. Dr. Mitchell made her feelings clear. According to her, some lives are worth more than others. The words stung because they reflected a truth Jennifer had been trying to avoid since starting her residency. Medicine, for all its noble ideals, was still subject to economics, politics, and personal bias. But standing here, watching Jake fight for every breath, those considerations felt obscene. "I need to examine him again," Jennifer said. "Maybe. There's something we missed, something that might change the equation." Inside Jake's room, Jennifer reviewed his chart while Pat checked his IV lines. The medical facts were stark. Massive anterior wall myocardial infarction, ejection fraction below 30%, multiple vessel disease requiring immediate surgical intervention. But it was the non-medical details that caught her attention. "Pat, you said he was protecting someone when he collapsed?" Elderly, homeless veteran, being mugged by 3 guys. Morrison took them all on before his heart gave out. Pat's voice carried grudging respect. "Paramedics said they'd never seen anything like it. Guy was already having chest pains, but he wouldn't back down." Jennifer pulled up Jake's chest x-ray on the tablet, studying the shadows and contours that revealed decades of wear on a human body. But there, barely visible in the lower left quadrant, was something that made her pause. "Pat, look at this." She pointed to a small, dense shadow near Jake's ribs. "See that?" Pat leaned in, her combat medic training kicking in. "That's shrapnel, old wound, probably years old. And here," she pointed to another area, "that's not normal bone density. This guy's been shot." The implications hit them both simultaneously. Homeless alcoholics didn't typically carry shrapnel and healed gunshot wounds. Those were the marks of combat, of service in places where American soldiers faced real danger. "We need to document this," Jennifer said, her mind racing. "If he really was military, there might be medical records, service records, something that proves..." "Proves what?" Dr. Sarah Mitchell's voice cut through their conversation like a scalpel. She stood in the doorway, impeccably dressed despite the early hour, her expression cold and professional. "That you're wasting valuable time on a patient I've already triaged?" Jennifer straightened, finding courage she didn't know she possessed. "Dr. Mitchell, we've found evidence of combat wounds, shrapnel, old gunshot injuries. This man has seen military action." Sarah stepped into the room, her gaze flicking to the monitors that showed Jake's deteriorating condition. And that changes. What exactly? Plenty of veterans end up homeless and addicted. Military service doesn't immunize someone against poor life choices. But it might explain them, Pat interjected, her voice barely controlled. PTSD, survivor's guilt, injuries that led to prescription drug dependence. You can't just dismiss. I can, and I will. Sarah's tone brooked no argument. This hospital operates on evidence-based medicine, not sentiment and speculation. Mr. Morrison's current condition is the result of years of alcohol abuse and neglect. His theoretical military service doesn't change the medical reality. Jake's eyes fluttered open, his consciousness surfacing through the haze of medication and pain. The voices around his bed sounded distant, distorted, but he caught enough to understand the debate raging over his unconscious body. "Doctor," he said, his voice barely above a whisper. Sarah turned, surprised by his awareness. "You want evidence? Check my left shoulder blade. Scar from a knife wound, Mogadishu, 1993. Right thigh bullet wound from the same mission. Dog tags are in my jacket pocket. Serial number Alpha 779 Delta 4. The specificity of his details cut through the room's tension like a blade. Jennifer immediately moved to examine the areas he'd mentioned, while Pat retrieved his jacket from the personal effects bag. "Here," Pat said, pulling out a set of dog tags that were older and more worn than standard military issue. She read the information aloud. "Morrison, Jake T. serial number 37794 Delta. Blood type O negative. Religion, Protestant." Sarah felt something cold settle in her stomach. The serial number format was wrong for standard military. It followed the pattern used for classified operations, for soldiers whose official existence was compartmentalized and protected. Dr. Marcus Webb appeared in the doorway, drawn by reports of the commotion in the ICU. "What's the situation?" "We've discovered that Mr. Morrison has documented military service," Jennifer said, her voice gaining strength. "Combat wounds, classified serial numbers. This isn't just a homeless veteran, Dr. Webb. This is someone who served in special operations." Webb stepped closer, his own military background making him immediately recognize the significance of Jake's serial number format. During his service as a Navy corpsman in Vietnam, he'd encountered similar identification patterns, soldiers whose missions were so classified that their very existence was a state secret. "Dr. Mitchell," Webb said carefully, "perhaps we should reconsider our position on this case." Sarah felt the walls closing in around her. The comfortable certainties that had guided her career, the clear distinctions between worthy and unworthy patients, were crumbling in the face of information that changed everything. But before she could respond, Jake's monitors began screaming alarms. His blood pressure plummeted, his heart rhythm became erratic, and the numbers that had been holding steady suddenly painted a picture of imminent cardiac arrest. "He's crashing," Pat shouted, reaching for the emergency medications. "We need to get him to surgery now, or we're going to lose him." Jennifer looked at Sarah, her eyes pleading. "Dr. Mitchell, please. Whatever he was, whatever he did, he's dying. Right now, right here, he's just a man who needs our help." Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Sarah stared at the monitors, at Jake's pale face, at the dog tags that suggested a story far more complex than she'd assumed. Everything she'd built her career on told her to walk away, to let someone else make the hard choices. But as Jake's heart struggled against the damage that time and trauma had inflicted, Sarah found herself facing a decision that would define not just his fate, but her own understanding of what it truly meant to heal. The monitors continued their urgent warnings, time running out for a man whose secrets were only beginning to emerge. 300 miles south of Boston, Director Rebecca Chen sat in her secure office at CIA headquarters in Langley, reviewing overnight intelligence briefings when her encrypted phone rang. The caller ID showed a number she recognized. Colonel James Patterson, Pentagon liaison for classified military records. "Rebecca, we have a situation." Patterson's voice carried the weight of 30 years of military service. "I just received a call from a hospital in Boston. They're treating a man named Jake Morrison, and his military serial number is flagged in our database." Rebecca's coffee cup paused halfway to her lips. She knew that name, had seen it in classified files that were buried so deep, most people with her clearance level didn't even know they existed. Jake Morrison, Operation Restore Hope, Somalia, 1993. That's the one. He's apparently dying in a civilian hospital, and they're trying to verify his service record. Rebecca set down her coffee and pulled up Jake's file on her secure terminal. The photograph that appeared showed a young man in his early 30s, clean-shaven, sharp-eyed, wearing the distinctive beret of the 1st Special Forces Operational Detachment Delta. The man in the picture bore little resemblance to the homeless veteran currently fighting for his life in Boston. How did they get his serial number? Hospital found his dog tags. The format triggered an automatic flag in the system. Patterson's voice grew grim. "Rebecca, if this gets out, if someone starts digging into why Jake Morrison's records are classified, I know." Rebecca scrolled through Jake's file, reading details that fewer than 20 people in the entire U.S. government were authorized to access. How much do they know? Just that his serial number doesn't match standard military records. But there's a doctor there asking questions, a social worker making calls to veteran services. It's only a matter of time before someone with the right clearance notices the discrepancies. Rebecca stared at the mission report dated October 3rd, 1993. Operation Gothic Serpent, the classified rescue mission that officially never happened, that saved 200 hostages from a terrorist compound in Mogadishu while the world's attention was focused on the Battle of the Black Sea. Jake Morrison had led a team of 5 operators into hell and emerged alone, carrying intelligence that prevented a massive terrorist attack on American civilians. The mission had been a success by every measurable standard, except for the 4 men who didn't come home. "Rebecca, are you there?" "I'm here." She closed Jake's file and opened another, her brother Michael's. Lieutenant Michael Chen, Navy SEAL, killed in action during a classified operation in 1994. Another hero whose sacrifice would never be publicly acknowledged, whose family was told he died in a training accident. "What's his medical condition?" "Massive heart attack. Needs immediate surgery, but the attending physician refused the case. Something about him being homeless and an alcoholic." The irony was bitter enough to choke on. Jake Morrison had sacrificed everything for his country, his team, his mental health, his future. And 30 years later, he was dying because a doctor thought he wasn't worth saving. "Send me everything you have on the hospital and the medical staff involved," Rebecca said, her mind already working through the implications. "I need to know who we're dealing with." "Rebecca, what are you thinking?" She stared at the wall of her office, where commendation letters and photos of fallen agents reminded her daily of the cost of service. "I'm thinking it's time to bring Jake Morrison in from the cold." Back in Boston, Jake's condition had stabilized. Enough for emergency transport to the cardiac surgery suite, but only barely. Dr. Jennifer Walsh worked frantically to keep his blood pressure up, while Pat Rodriguez coordinated with the surgical team. They'd managed to buy time, but not much. Dr. Sarah Mitchell stood in the observation area above the operating room, watching the controlled chaos below. She'd agreed to supervise the surgery, not to perform it, but to ensure that Dr. Walsh didn't make any critical errors. It was a compromise that satisfied hospital protocol while keeping her hands technically clean. But as she watched Jake's unconscious form being prepped for surgery, Sarah found herself thinking about the dog tags, the serial number that had triggered such unusual interest from hospital administration. Dr. Webb had made several calls after, examining Jake's records, each one more serious than the last. Dr. Mitchell. Dr. Webb appeared beside her in the observation gallery. "I need to speak with you privately." They stepped into the adjacent conference room, where Webb closed the door and activated the white noise generator, a precaution usually reserved for discussions involving patient confidentiality or legal liability. "I've been making calls about Jake Morrison," Webb said without preamble. "His serial number format indicates special operations, possibly black ops. Sarah, this man isn't just a veteran. He's someone whose service was so classified that his records are sealed at the highest levels of government." Sarah felt the familiar tightness in her chest that came whenever her carefully ordered world encountered chaos. "That's impossible. If he'd been special operations, there would be support systems, veteran benefits, recognition. Not for operations that officially never happened." Webb's expression was grave. "I served in Vietnam. Sarah, I know what happens to soldiers who carry state secrets. Sometimes the best way to protect national security is to let heroes disappear." The words hit Sarah like a physical blow. She'd built her refusal to treat Jake on assumptions about his worth, his character, his place in society. But if Webb was right, if Jake Morrison was one of America's invisible heroes, then her medical judgment had been catastrophically wrong. "How classified are we talking about?" "I don't know. But I received a call from the Pentagon asking very pointed questions about why a civilian hospital was accessing military records. That doesn't happen for ordinary veterans." Through the observation window, they could see Jennifer Walsh beginning the complex process of opening Jake's chest, her young hands steady despite the magnitude of the task ahead. His heart, damaged by decades of trauma and neglect, was about to be laid bare under surgical lights. "There's something else," Webb continued. "A CIA representative is flying up from Washington. She'll be here within the hour, carrying Jake Morrison's complete military record." Sarah's world tilted on its axis. The homeless drunk she'd dismissed as unworthy of her skills might be one of the most decorated soldiers in American history. The man whose life she'd deemed worthless might have saved hundreds of lives in service to his country. "What have I done?" she whispered, the words slipping out before she could stop them. Webb's expression softened slightly. "You made a decision based on incomplete information. The question now is what you're going to do with the complete picture." Below them, Jennifer Walsh worked with desperate precision to repair a heart that had been broken in ways that went far beyond the physical. Jake Morrison's chest rose and fell with mechanical regularity, his life sustained by machines, while his past finally began to surface after 30 years of carefully maintained anonymity. Sarah pressed her hand against the observation window, watching the surgery that she should have been performing. For the first time in her career, she found herself questioning not just a medical decision, but the fundamental assumptions that had guided her entire professional life. In a few hours, she would learn the truth about Jake Morrison. But already, standing in that sterile observation room, she was beginning to understand that the truth about herself might be far more difficult to face. The surgery continued below, a race against time to save a man whose greatest battles had been fought in shadows, whose greatest victories had been deliberately forgotten, and whose greatest sacrifice was only now beginning to come to light. Director Rebecca Chen's black sedan pulled into the emergency bay of Massachusetts General Hospital at precisely 2:47 p.m., her driver navigating through the maze of ambulances and medical vehicles with practiced efficiency. In her briefcase sat A file that would transform Jake Morrison from anonymous homeless veteran to classified American hero. But the weight of carrying 30 years of institutional secrecy pressed down on her shoulders like lead. She'd made this trip against the advice of her superiors, against protocol, against every instinct that had kept government secrets safe for 3 decades. But some truths, Rebecca had decided during the flight from Washington, were too important to remain buried. Dr. Marcus Webb met her at the hospital's administrative entrance, his expression carefully neutral, despite the obvious tension in his bearing. "Director Chen, thank you for coming so quickly. Where is he?" Rebecca's voice carried the clipped efficiency of someone accustomed to making decisions that affected national security. "Still in surgery. Dr. Walsh has been working for over 4 hours. It's complicated." They walked through corridors, filled with the controlled chaos of a major teaching hospital, past patients and families dealing with their own medical crises, none of them aware that history was being rewritten in an operating room 3 floors above. Webb led her to his office, where Sarah Mitchell waited with the posture of someone facing execution. Sarah had spent the hours since Webb's revelation in a kind of emotional free fall, every certainty she'd built her career on crumbling under the weight of what she was about to learn. "Dr. Mitchell, this is Director Rebecca Chen from the Central Intelligence Agency," Webb said, closing the door behind them. Rebecca studied Sarah with the assessing gaze of someone trained to read people's deepest motivations. She saw intelligence, ambition, and something else, the kind of fear that came from realizing you'd made a mistake that could define the rest of your life. "Dr. Mitchell, I understand you refuse to operate on Jake Morrison." Sarah's throat felt dry as desert sand. "I made a medical decision based on the information available to me at the time, which was homeless veteran, chronic alcoholism, poor prognosis for long-term survival." The words sounded clinical and hollow even as Sarah spoke them. Limited hospital resources, other patients with better outcomes waiting for surgery. Rebecca sat, her briefcase on Webb's desk, her fingers hovering over the combination locks. "Dr. Mitchell, what I'm about to show you is classified at the highest levels of government. You'll be required to sign non-disclosure agreements that carry criminal penalties for violation. Do you understand?" Sarah nodded, not trusting her voice. Rebecca opened the briefcase and withdrew a thick file marked with classification stamps and security warnings. She placed it on the desk between them, the physical weight of paper seeming insignificant compared to the emotional weight of the secrets it contained. "Jake Morrison," Rebecca began, opening the file to reveal photographs of a young soldier in dress uniform, was not just a veteran. He was one of the most highly decorated special operations soldiers in American history, and his service was so classified that officially his greatest mission never happened. The first photograph showed Jake at his graduation from Delta Force selection, young and confident, surrounded by men who represented the absolute elite of American military capability. Sarah stared at the image, trying to reconcile it with the homeless man she'd dismissed hours earlier. "October 3rd, 1993, Rebecca continued, turning pages to reveal mission briefings and operational reports. While the world's attention was focused on the Battle of Mogadishu, Jake Morrison led a 5-man team into a terrorist compound 30 miles outside the city. Intelligence indicated that 200 civilian hostages, aid workers, journalists, embassy personnel were being held for execution. Webb leaned forward, his own military background helping him understand the magnitude of what Rebecca was describing. A rescue mission. More than that, the terrorists had obtained detailed plans of American civilian infrastructure, power grids, water systems, transportation hubs. They were planning coordinated attacks that would have killed thousands of American civilians. Rebecca turned to a page covered in declassified tactical maps. Jake's mission was to extract the hostages and secure the intelligence before it could be transmitted to terrorist cells in the United States. Sarah found herself staring at mission photographs that showed the aftermath of what must have been an intense firefight. Bodies of terrorists scattered throughout a compound, evidence of a battle fought with desperate precision. The mission was successful, Rebecca said quietly. All 200 hostages were extracted alive. The terrorist intelligence was secured and destroyed. An attack that would have rivaled 9/11 in scope was prevented. She paused, her voice growing heavy. But Jake Morrison's team, Rodriguez, Williams, Chen, Martinez, didn't make it out. The silence in the room was broken only by the distant sounds of hospital activity. Sarah felt something cracking in her chest, a fissure in the wall she'd built around her emotions. Jake carried his wounded teammates toward the extraction point for 6 miles through hostile territory, Rebecca continued. When the helicopter arrived, he loaded the bodies of his 4 men before collapsing from blood loss and exhaustion. The mission report states that he refused medical evacuation until every member of his team was accounted for. Jesus, Webb whispered, his clinical composure finally breaking. Rebecca turned to the final section of the file, medical records, psychological evaluations, and discharge papers that painted a picture of a hero's destruction. The mission was immediately classified. The hostages were sworn to secrecy. Jake Morrison's heroism was buried so deep that even he was forbidden from acknowledging it. He was discharged with a cover story about a training accident. No recognition, no support for the trauma he'd endured. Sarah's hands trembled as she looked at psychological evaluation reports that documented Jake's descent into PTSD, survivors, guilt, and eventually alcoholism. The man she'd dismissed as a worthless drunk had spent 30 years carrying the weight of classified heroism, unable to seek help because his greatest accomplishment was a state secret. He saved hundreds of lives, Rebecca said, closing the file, prevented a terrorist attack that would have killed thousands. And when he needed help, when the trauma and guilt finally broke him, there was no system in place to catch him because, officially, his service never happened. Sarah felt tears burning behind her eyes, tears of shame, of recognition, of devastating understanding. He's been homeless for how long? 15 years, in and out of shelters, detox centers, emergency rooms, always giving false names, never seeking veteran services because doing so would require him to explain service that officially never existed. Through the office windows, they could see the media vans that had begun gathering as word of something unusual happening at MGH leaked to the press. But none of them knew the real story, that in an operating room upstairs, one of America's greatest heroes was fighting for his life, while the doctor who'd refused to save him finally understood the magnitude of her mistake. "Where does this leave us?" Webb asked, his voice barely above a whisper. Rebecca looked directly at Sarah, her gaze carrying the weight of institutional guilt and personal responsibility. "That depends on whether Jake Morrison survives surgery, and whether Dr. Mitchell is prepared to live with the consequences of her decision." Sarah closed her eyes, seeing Jake's face as he'd looked at her in the emergency room. Intelligent, dignified, resigned to being dismissed by someone who thought she understood his worth. "I understand you don't think I'm worth saving." Now she knew the truth. Jake Morrison had already saved more lives than she ever would, had sacrificed more for his country than she could imagine, had carried burdens that would have broken lesser men, and she had deemed him worthless. The silence in Dr. Webb's office stretched like a taut wire, ready to snap under the weight of revelation. Sarah stared at the classified photographs of Jake Morrison, young, proud, surrounded by teammates who would die under his command, and felt something fundamental shift inside her chest. Not the clean break of a bone, but the slow, grinding collapse of everything she'd built her identity upon. Dr. Mitchell, Rebecca Chen's voice cut through the silence with surgical precision. You need to understand the full scope of what Jake Morrison sacrificed. Those 4 men who died in Somalia, they weren't just his teammates. They were his responsibility, his brothers, his family. He's carried their deaths for 30 years because he couldn't honor their memory publicly. Sarah's hands trembled as she touched the mission photographs, seeing evidence of violence that went far beyond anything in her sterile surgical world. Why wasn't he given support? Medal of Honor recipients receive Medal of Honor recipients whose missions can be acknowledged, Rebecca interrupted. Jake Morrison's mission was so classified that awarding him recognition would have exposed operational capabilities we couldn't afford to reveal. The greater good demanded his sacrifice remain invisible. Dr. Webb studied the tactical reports with the eye of someone who understood military operations. The psychological impact of carrying classified trauma, I've seen it destroy careers, marriages, entire lives. Without the ability to process the experience publicly, without recognition or support, the guilt eats them alive, Rebecca finished. Jake Morrison has spent 3 decades believing he failed his team, failed his mission, failed his country, because officially, none of it ever happened. Through the office windows, Sarah could see more media vans arriving, drawn by rumors of something significant happening at MGH. Hospital security was setting up barriers, but she knew it was only a matter of time before the story leaked. The thought of facing public scrutiny for her decision made her stomach clench with dread. There's more, Rebecca said, opening another section of Jake's file. After his discharge, Jake attempted suicide twice. Both times, he was hospitalized, under assumed names, because seeking help through VA channels would have required explaining service that was classified. The system that should have caught him was legally prohibited from acknowledging his existence. Sarah closed her eyes, seeing Jake's face in the emergency room with devastating new clarity. The resignation in his eyes hadn't been the surrender of a broken man. It had been the exhaustion of someone who'd been fighting invisible battles for 3 decades. A soft knock interrupted her spiraling thoughts. Nurse Pat Rodriguez entered, still wearing surgical scrubs, her face drawn with exhaustion, but carrying a hint of cautious optimism. "Dr. Walsh asked me to update you," Pat said, her gaze moving between the 3 officials. "The surgery is complete. It was touch and go. We lost him twice on the table, but Jennifer managed to stabilize him. Triple bypass with 2 additional grafts. His heart. It was more damage than anyone realized." Rebecca leaned forward. "Will he survive?" "The next 24 hours are critical, but Dr. Walsh did exceptional work." Pat's expression hardened as she looked at Sarah. "No thanks to our chief of cardiac surgery." The accusation hung in the air like smoke from a funeral pyre. Sarah felt the weight of judgment from everyone in the room, but it was nothing compared to the judgment she was passing on herself. "Nurse Rodriguez," Rebecca said carefully, "how much do you know about Mr. Morrison's background?" "Enough to know he's military, special forces from the sound of it, and enough to know that Dr. Mitchell's decision was based on prejudice rather than medical necessity." Rebecca exchanged a glance with Webb, then made a decision that would change multiple lives. "Please sit down, Nurse Rodriguez. What I'm about to tell you requires the same security clearance I've just given Dr. Mitchell and Dr. Webb." Pat's expression shifted from anger to confusion as Rebecca outlined the basics of Jake's classified service, his heroic mission, and the institutional failures that had led to his current circumstances. With each revelation, Pat's face grew more grim, her understanding of the situation's magnitude deepening. 30 years, Pat said finally. 30 years he's been carrying this alone. And now there's someone else who needs to know, Rebecca said. Jake's son is flying in from Tennessee. Tommy Morrison, age 24. He believes his father abandoned his family when he was 4 years old. Sarah's breath caught. He has a son. Jake left his family after his second suicide attempt. He was convinced that his presence was poisoning everyone around him, that the classified trauma he couldn't explain was destroying his marriage and damaging his child. So he disappeared, became homeless, let them believe he'd abandoned them, rather than explain why he was broken. The cruelty of it was breathtaking. Jake Morrison had sacrificed not just his life and his sanity for his country, but his relationship with his son, allowing the boy to grow up believing his father was worthless rather than revealing the truth about his heroism. "Where is Tommy now?" Webb asked. Landing at Logan Airport in 2 hours, he received a call that his father was dying, and after years of no contact, he's coming to, well, I'm not sure why he's coming. Closure, maybe, or forgiveness, or just to watch the man who abandoned him finally pay the price. Sarah stood abruptly, moving to the window where she could see the gathering media circus. "This is going to destroy everything," she said quietly. "When this story comes out, a homeless Medal of Honor recipient refused surgery by a doctor who thought he was worthless. My career is finished." "Your career?" Pat's voice carried dangerous quiet. "That man has been dying in pieces for 30 years, and you're worried about your career." "Dr. Mitchell," Rebecca said, her tone carrying the authority of someone accustomed to handling national crises. "Your career is the least of our concerns right now. Jake Morrison's story is about to become public, whether we want it to or not. The question is whether you're going to be part of the problem or part of the solution." Sarah turned from the window, seeing her reflection ghosted against the glass, a successful surgeon in an expensive suit, surrounded by the trappings of professional achievement. But underneath the surface, she saw something else. A 12-year-old girl standing over her father's body, making vows about worth and value that had led her to this moment of moral reckoning. "What do you want from me?" she asked. "Nothing you're not already obligated to provide," Rebecca replied. "The best possible medical care for a man who deserves it. And maybe, if you're capable of it, some recognition that worth isn't measured by bank accounts or social status." Outside, Tommy Morrison's plane was approaching Boston, carrying a young man who'd spent 20 years hating the father he was about to discover was a hero. In the ICU, Jake Morrison fought for his life, unaware that his greatest secret was finally being revealed. And in Dr. Webb's office, Sarah Mitchell faced the choice that would define not just her career, but her character. Would she continue to hide behind the prejudices that had brought her to this moment, or would she find the courage to become the doctor and the person that Jake Morrison's sacrifice demanded she be? The weight of truth she was discovering was far heavier than the burden of ignorance. Tommy Morrison's rental car pulled into Massachusetts General Hospital's parking garage at 6:23 p.m., his hands gripping the steering wheel with white-knuckled intensity. 20 years of carefully constructed anger warred with unwanted concern, as he sat in the concrete silence, trying to prepare himself for seeing the man who had abandoned his family. 4 years old when his father disappeared. 20 years of telling himself he didn't care. And now Jake Morrison was dying, and Tommy had flown across the country for reasons he couldn't articulate even to himself. 4 floors above, Dr. Sarah Mitchell stood outside the cardiac ICU, staring through the observation window at the man whose life she'd nearly thrown away. Jake lay unconscious, connected to a maze of tubes and monitors that painted a precarious picture of survival. Dr. Jennifer Walsh had performed miracles in the operating room, but Jake's recovery would be measured in millimeters of progress over days, not hours. "Dr. Mitchell?" Jennifer emerged from Jake's room, exhaustion evident in every line of her young face. "His vitals are stable, but weak. The surgery was more complicated than we anticipated. Years of untreated heart disease, damage from what looks like old, shrapnel wounds that affected blood flow. It's like his body has been fighting a war for decades. Sarah nodded, unable to trust her voice. She'd spent the past 4 hours in a kind of emotional purgatory, replaying every interaction with Jake Morrison through the lens of what she now knew about his service. Every dismissive comment, every assumption about his worth, every moment of clinical detachment now felt like a betrayal of everything medicine was supposed to represent. "Has his son arrived?" Sarah asked. "Security called up. He's in the elevator now." Jennifer's expression grew concerned. "Dr. Mitchell, what are we going to tell him? The CIA director said his father's service is classified. How do we explain why a homeless veteran suddenly has federal agents and media attention?" Before Sarah could answer, the elevator doors opened to reveal a young man whose resemblance to Jake Morrison was unmistakable. Tommy had his father's strong jawline and intelligent eyes. But where Jake carried the weight of hidden trauma, Tommy radiated the controlled anger of someone who'd built his life around being unwanted. Director Rebecca Chen approached him first, her federal credentials and professional demeanor immediately putting Tommy on guard. "Mr. Morrison, I'm Director Rebecca Chen, Central Intelligence Agency. We need to speak about your father." Tommy's expression hardened. "My father is a drunk who abandoned his family 20 years ago. Whatever crimes he's committed now, they're not my problem." "Mr. Morrison," Sarah stepped forward, her medical training helping her recognize the pain beneath Tommy's anger. "I'm Dr. Sarah Mitchell, Chief of Cardiac Surgery. Your father has undergone major heart surgery. He's alive, but critical." "Why should I care?" Tommy's voice carried practiced indifference, but Sarah caught the slight tremor that betrayed deeper emotions. "He made his choice when he walked out on us." Rebecca exchanged a glance with Sarah, then made a decision that would shatter Tommy's understanding of his own life. "Mr. Morrison, your father didn't abandon you. He sacrificed his relationship with you to protect national security and to spare you from trauma he couldn't explain." The words hit Tommy like a physical blow. "What the hell does that mean?" "It means," Rebecca said gently, "that your father is one of the most decorated soldiers in American history, and his service was so classified that he was legally prohibited from explaining why he was broken when he came home from war." Sarah watched Tommy's face cycle through disbelief, confusion, and something that might have been hope before settling back into defensive anger. "You're telling me my father was some kind of secret agent? That's why he chose alcohol over his family?" "I'm telling you," Rebecca said, "that your father led a mission that saved 200 lives and prevented a terrorist attack that would have killed thousands of Americans. And when his team was killed in the process, he carried that guilt alone for 30 years because the mission was too classified to acknowledge." Through the observation window, they could see Jake beginning to stir, consciousness returning. In fragments, his eyes opened, unfocused and confused, searching the room with the automatic threat assessment of someone whose survival had once depended on constant vigilance. Tommy stared at his father through the glass, trying to reconcile. This broken man with the hero Rebecca was describing. If he was such a hero, why did he become a drunk? Why did he leave us? Sarah found herself speaking, driven by understanding that came from her own painful childhood. Because sometimes the weight of what we've lost becomes unbearable, and we convince ourselves that everyone we love would be better off without us. The honesty in her voice cut through Tommy's defenses. He looked at her with new attention, recognizing something in her expression that mirrored his own confusion. Your father has been homeless for 15 years, Rebecca continued, living on the streets, in and out of shelters, protecting other veterans because he couldn't protect his own team. He's been dying by degrees, Mr. Morrison, not from alcohol, but from survivor's guilt and the inability to honor his fallen comrades. Jake's eyes found the observation window, his gaze moving between the faces gathered there. When he saw Tommy, his expression cracked with an emotion so raw that Sarah had to look away. "He sees you," Jennifer said softly. Tommy pressed his hand against the glass, 20 years of anger warring with a child's desperate need for his father's love. Can I talk to him?" Sarah nodded, leading Tommy into Jake's room, where the steady beep of monitors provided counterpoint to the most difficult conversation either man would ever have. Jake's voice was barely a whisper, roughened by the breathing tube that had been removed only hours earlier. "Tommy, you're real." "I'm real, Dad." The word Dad seemed to surprise Tommy as much as Jake. "They tell me you're some kind of war hero." Jake's laugh was bitter, painful. "I'm a failure who got good men killed." "You saved 200 people," Tommy said, his voice growing stronger. "You prevented a terrorist attack. You sacrificed everything for your country." "I sacrificed you," Jake replied, tears cutting tracks down his weathered face. "I let you grow up thinking I didn't love you because I couldn't explain why I was broken, I thought. I thought you'd be better off hating me than knowing what I'd become." Tommy reached for his father's hand, 20 years of carefully maintained distance collapsing in an instant. "I could have handled the truth, Dad. I could have helped you carry it." Sarah backed toward the door, feeling like an intruder on a moment of reconciliation that had been delayed by 3 decades of institutional secrecy and personal pain. But Jake's voice stopped her. "Doctor," he said, his eyes finding hers, "the woman who didn't think I was worth saving. Are you the one who operated on me?" Sarah felt the weight of shame settle around her shoulders like a lead blanket. "No, Mr. Morrison. Dr. Walsh performed your surgery. I refused your case." Jake studied her face with the penetrating gaze of someone accustomed to reading people's deepest truths. "Because I'm homeless, because I'm a drunk, because I don't fit your idea of who deserves to live." The accusation was delivered without anger, which somehow made it more devastating. Sarah found herself unable to look away from eyes that held intelligence, pain, and a kind of weary understanding that came from decades of being dismissed by people who should have known better. "Yes," she said simply. "I was wrong, completely, catastrophically wrong." Jake nodded slowly, as if her honesty was exactly what he'd expected. "Doctor, I've been judged by my appearance for 20 years, by police, social workers, emergency room staff, people who see a homeless veteran and assume they know everything about me. You're not the first, and you won't be the last." "That doesn't excuse what I did." "No," Jake agreed, "but it might explain why you did it. The question is what you're going to do now that you know better." Outside Jake's room, media crews were setting up for what would become one of the biggest stories of the year, the homeless Medal of Honor recipient whose heroism had been hidden for 3 decades. But inside that room, surrounded by the machinery, keeping him alive, Jake Morrison was having a different kind of conversation about worth, judgment, and the possibility of redemption, for both himself and the doctor who'd almost let him die. The first rays of dawn filtered through the ICU windows as Sarah Mitchell sat in the chair beside Jake Morrison's bed, a position she'd maintained for the past 6 hours despite the protests of nursing staff and her own exhaustion. Sleep had become impossible since learning the truth about the man she'd dismissed as worthless. Every time she closed her eyes, she saw the faces of Jake's fallen teammates, heard Tommy's pain-filled voice asking why his father had abandoned him, felt the weight of her own prejudices crushing down like a physical force. Jake stirred in the pre-dawn quiet, his eyes opening with the gradual awareness of someone emerging from deep sedation. The mechanical ventilator had been removed during the night, replaced by a simple oxygen cannula that allowed him to speak in raspy whispers. "You're still here," he observed, his voice carrying surprise rather than accusation. Sarah straightened in her chair, suddenly aware of how she must look: rumpled clothes, smeared makeup, hair that had long since escaped its professional styling. "I needed to. I wanted to make sure you were stable." Jake's eyes clearer, now than they'd been since his arrival, studied her with the penetrating gaze she was learning to recognize. "That's not why you're here, Doctor. You could have checked my chart from your office." The honesty in his voice, devoid of anger or recrimination, somehow made her shame more bearable and more painful at the same time. "No, I'm here because I need to understand how I became someone who could look at a human being and decide he wasn't worth saving." "Because you're human," Jake said simply. "Because you made assumptions based on incomplete information. Because the system taught you to think in terms of resource allocation rather than human dignity." Sarah felt tears burning behind her eyes. "That's not good enough. I'm a doctor. I took an oath to do no harm, and I nearly let you die because I thought I knew who you were." Jake shifted slightly in the bed, wincing as the movement pulled at his surgical incisions. "Doctor, can I tell you something about judgment? About the assumptions we make when we don't know the whole story?" Sarah nodded, not trusting her voice. "Somalia, 1993. My team was inserted into a compound where terrorists were holding hostages. Our intelligence said they were aid workers, journalists, embassy personnel, innocent civilians who needed rescue." Jake's eyes grew distant with memory. "But when we got there, we found something else. Some of those hostages were CIA operatives, deep cover agents whose exposure would have compromised operations across 3 continents. Sarah leaned forward, drawn into the story despite herself. The mission parameters changed in real time. We weren't just rescuing civilians anymore. We were protecting national security assets. And my team, my friends, they died not knowing why those particular hostages were worth their lives." Jake's voice grew thick with emotion. "For 30 years, I've carried the guilt of sending Rodriguez, Williams, Chen, and Martinez to their deaths for people whose value I couldn't explain to their families." "But you didn't know," Sarah said quietly. "You couldn't have known the whole story." "Exactly." Jake's eyes found hers. "Just like you couldn't have known my story when you saw a homeless alcoholic who needed surgery. We both made decisions based on incomplete information, Doctor. The difference is that your decision was reversible." The parallel hit Sarah like a physical blow. She'd spent hours castigating herself for judging Jake without knowing his true worth, but he was showing her the same grace she'd been unable to extend to him. "Mr. Morrison, Jake, I don't know how to live with what I almost did." "The same way I live with what I did do," Jake replied. "One day at a time, trying to be better than we were yesterday, trying to honor the people we failed by not failing anyone else." The door opened quietly, and Tommy Morrison entered, carrying 2 cups of coffee and wearing the rumpled clothes of someone who'd spent the night in hospital waiting rooms. His eyes still held traces of the anger that had defined his relationship with his father for 20 years, but something had shifted during their reunion, a crack in the wall of resentment that had let light through. "Dad, you're awake." Tommy set the coffee on the bedside table and took the chair on the opposite side of the bed from Sarah. "How are you feeling?" "Like I've been hit by a truck, then had someone perform major surgery on my heart," Jake said with a weak smile. "So basically better than I have in years." Tommy laughed despite himself, the sound carrying both relief and residual pain. "Director Chen wants to talk to you when you're stronger. Something about declassifying your mission, making your service public." Jake's expression grew troubled. Public recognition was never what I wanted, son. The mission was classified for good reasons. Maybe 30 years ago, Sarah interjected, surprising herself by speaking. But those reasons might not apply anymore, and maybe the country needs to see what real heroism looks like. Jake studied her face. You think public recognition would somehow balance the scales? Make up for 30 years of invisibility? I think, Sarah said carefully, that there are probably other veterans out there carrying classified trauma, other heroes who've been forgotten by the system that sent them to war. Maybe your story could help them. Tommy nodded slowly. There's something else, Dad. Director Chen told me about a foundation, support systems for veterans with classified service, medical care for those who fall through the cracks. She thinks you could help design it based on what you've experienced. Jake closed his eyes, overwhelmed by the possibility of turning his suffering into something meaningful. 30 years too late for Rodriguez, Williams, Chen, and Martinez. But not too late for the next Jake Morrison, Sarah said. Not too late for the next veteran who comes home broken and invisible. The room fell quiet except for the steady beep of monitors and the distant sounds of a hospital coming to life with the morning shift. Through the windows, Sarah could see media vans still gathered in the parking lot, waiting for the story that would transform Jake Morrison from anonymous homeless veteran to recognized American hero. But inside this room, the real transformation was happening more quietly, in the relationship between a father and son finding their way back to each other, in the recognition that heroes could be broken and still remain heroic, in the understanding that redemption was possible for both those who served and those who failed to see their service. Dr. Mitchell, Jake said suddenly, when I'm stronger, when I'm out of here, I want to work with you on something. Sarah looked up, confused. I don't understand. The foundation Director Chen mentioned, I want you to help design the medical protocols. Because you understand something that a lot of doctors don't. You understand what it means to make the wrong decision, and you understand the cost of getting it right. The offer was so unexpected, so generous, that Sarah felt her carefully. Maintained composure, finally crack. Jake, I don't deserve, none of us deserve what we get, Jake interrupted gently. Good or bad, but we can choose what we do with it. You can choose to let your mistake define you, or you can choose to let it teach you. I'm offering you the chance to turn your worst professional moment into something that might save other lives. Tommy looked between his father and the doctor, seeing something he'd never witnessed before. True forgiveness offered without condition, grace extended despite profound failure. I accept, Sarah said, her voice barely above a whisper. You'll have me if you think I can contribute something meaningful, I accept. Jake smiled, the expression transforming his weathered face. Doctor, you've already contributed more than you know. You've given me the chance to turn 30 years of invisible service into something visible. You've given me the opportunity to honor my fallen teammates by making sure no other veteran dies unrecognized. Outside, the media waited to tell the story of Jake Morrison's heroism. But inside this hospital room, a different story was being written, one of redemption, forgiveness, and the possibility that even our greatest failures could become the foundation for our most meaningful work. The heart monitor continued its steady rhythm, marking not just Jake Morrison's recovery, but the beginning of something larger, a mission that would honor the fallen, serve the living, and prove that sometimes the most important battles are fought not on foreign soil, but in the quiet moments when we choose to see each other's true worth. 3 weeks after Jake Morrison's surgery, Massachusetts General Hospital's main auditorium buzzed with an energy that felt both ceremonial and electric. Media crews adjusted lighting, while Pentagon officials checked security protocols. But the real electricity came from the gathering crowd. Veterans in dress uniforms, hospital staff, government officials, and families whose lives had been touched. By invisible heroism finally brought into the light, Admiral Robert Sterling stood at the podium, his navy dress blues immaculate, the weight of his own decorated service evident in his bearing. Behind him, a large screen displayed the official Pentagon seal alongside photographs from Jake's 1993 Somalia mission, images that had been classified for 30 years and were now being seen by the public for the first time. Sarah Mitchell sat in the front row, wearing a simple black dress that reflected the solemnity of the occasion. Beside her, Dr. Jennifer Walsh and Nurse Pat Rodriguez represented the medical team that had fought to save Jake's life when their institution had nearly failed him. Dr. Webb sat with the hospital administration, his expression carrying the weight of systemic failures that were about to be publicly acknowledged. Tommy Morrison occupied the seat of honor beside the podium, his father's dress uniform, carefully preserved in a storage unit for 3 decades, now displayed on a military mannequin. Jake himself sat in a wheelchair, still recovering from surgery, but insistent on being present for what Director Rebecca Chen had called a long overdue accounting. "Ladies and gentlemen," Admiral Sterling began, his voice carrying the authority of someone accustomed to addressing matters of national importance. "We are gathered today to correct a 30-year-old injustice, to finally acknowledge a mission that saved hundreds of lives and prevented a terrorist attack that would have killed thousands of Americans." The audience settled into respectful silence as Sterling outlined the basics of Operation Gothic Serpent, the classified rescue mission that had extracted 200 hostages from a terrorist compound while securing intelligence that prevented coordinated attacks on American infrastructure. Master Sergeant Jake Morrison led a 5-man team into enemy territory with complete disregard for his own safety, Sterling continued. When his teammates, Sergeant Rodriguez, Corporal Williams, Staff Sergeant Chen and Private Martinez, were killed in the extraction, Morrison carried their bodies 6 miles through hostile territory, refusing evacuation until every member of his team was accounted for. Sarah watched Jake's face during the recitation of his heroism, seeing the pain that accompanied every mention of his fallen teammates. Even in this moment of recognition, his thoughts were with the men who couldn't be here to receive their own honors. "For 30 years, Sterling said, his voice growing heavy with institutional regret, national security requirements demanded that this mission remain classified. Master Sergeant Morrison was discharged with a cover story, forbidden from discussing his service, denied the recognition and support that his sacrifice merited. Director Rebecca Chen approached the podium to speak about the human cost of classified service. Jake Morrison is not unique in carrying invisible wounds from invisible wars. Across our intelligence and special operations communities, men and women serve in missions that officially never happen, that leave them unable to seek help through traditional channels because their service cannot be acknowledged." She paused, her gaze finding Jake in the front row. The result is often what we see here: heroes who become homeless, who struggle with addiction and trauma, who are dismissed by the very society they served because their greatest accomplishments must remain secret. The weight of that reality settled over the auditorium like a heavy blanket. Sarah felt it particularly acutely, knowing that she had embodied society's failure to recognize hidden service, had nearly let a hero die because she couldn't see past surface appearances. "Today marks not just the recognition of one man's service," Rebecca continued, "but the beginning of systematic change in how we support veterans of classified operations. The Morrison Foundation announced today will provide medical care, mental health services, and social support for veterans whose service cannot be traditionally documented." Admiral Sterling returned to the podium carrying a blue folder that contained the citation for America's highest military honor. "Master Sergeant Jake Morrison, by direction of the President of the United States and in accordance with the authority Invested in the Secretary of Defense, you are hereby awarded the Medal of Honor for conspicuous gallantry and intrepidity at the risk of your life above and beyond the call of duty. Jake struggled to stand as Sterling read the full citation. His surgical recovery making the movement painful, but his military bearing demanding that he receive this honor properly. Tommy moved to support his father, the gesture carrying weight. Beyond simple assistance, it was an acknowledgement of their renewed relationship, a son finally understanding the true nature of his father's absence. The Medal of Honor itself, a blue ribbon supporting a 5-pointed star, was placed around Jake's neck with the solemnity reserved for America's highest recognition of valor. But it was Jake's response that truly captured the moment's significance. "Admiral Sterling, Director Chen, distinguished guests," Jake began, his voice still rough from surgery but carrying new strength. "This medal doesn't belong to me alone. It belongs to Rodriguez, Williams, Chen, and Martinez, who gave their lives so that 200 innocent people could return to their families. It belongs to every veteran who has served in the shadows, who has carried classified trauma without recognition or support." He paused, his eyes finding Sarah in the audience. "It also belongs to everyone who has failed to see the worth in another human being and who has chosen to do better. Because recognition without action is meaningless, and honor without service is empty." Sarah felt the words like a benediction and a challenge. She stood as Jake continued speaking, her movement drawing attention from the audience and media cameras. "Dr. Sarah Mitchell," Jake said, acknowledging her directly, "will you join me at the podium?" The walk to the front of the auditorium felt like the longest of Sarah's life, every step carrying the weight of her mistake and the possibility of redemption. She reached the podium where Jake waited, his expression carrying forgiveness she still didn't believe she deserved. "Ladies and gentlemen," Jake said, "Dr. Mitchell initially refused to perform my surgery. She saw a homeless alcoholic and decided I wasn't worth saving. Today, she has agreed to serve as the Chief Medical Officer of the Morrison Foundation, ensuring that no veteran, classified or otherwise, will be denied care based on appearance or circumstances." The applause that followed was complex, acknowledgement of both failure and redemption, recognition that progress required confronting uncomfortable truths about institutional bias and personal prejudice. Sarah approached the microphone, her voice shaking as she spoke. "Jake Morrison taught me that worth isn't measured by wealth or status, but by character and service. The Morrison Foundation will ensure that medical care is provided based on human dignity, not social standing. We will train healthcare providers to see past surface appearances to the person beneath, to understand that every patient has a story we might not know." As the ceremony concluded and the audience slowly dispersed, Sarah remained at the podium with Jake and Tommy, the three of them representing different aspects of the same truth: that redemption was possible, that mistakes could become the foundation for meaningful change, and that sometimes the most important mission was simply learning to see each other's worth. The Medal of Honor gleamed against Jake's chest, but the real medal, the recognition that truly mattered, was the renewed relationship with his son, the friendship of people who had learned to see past his circumstances, and the knowledge that his invisible service would now help other invisible heroes. Outside, the media prepared to tell America about its newest Medal of Honor recipient. But inside the auditorium, the real story was just beginning. A story of how individual transformation could become institutional change, how personal failures could become collective healing, and how the courage to confront our own biases could become the foundation for a more compassionate world. The spotlight felt warm against Amira's face as she stood at the podium of the grand ballroom at the Marriott Marquis, looking out at an audience of 500 finance professionals gathered for the annual Diversity in Investment Management conference. 6 months had passed since that pivotal day at Sterling Capital, and the woman who now commanded this stage bore little resemblance to the uncertain junior analyst who had once cowered in Patricia Webb's office. "When I walked into that HR meeting," Amira said, her voice carrying clearly through the hushed auditorium, "I thought I had two choices: compromise my identity or lose my career. What I learned is that sometimes the most powerful choice is the one you don't know you have yet." She paused, scanning the faces in the audience, young professionals of every background, many wearing hijabs, turbans, and other visible expressions of their faith and heritage. In the front row, she spotted a familiar face, Aisha, a recent graduate who had reached out after seeing Amira's story in the Financial Times. "My father taught me that strength isn't about having power. It's about how you use it when you discover you've had it all along." Amira's hand moved unconsciously to adjust her hijab, a midnight blue silk that perfectly complemented her tailored charcoal suit. "6 months ago, I chose to stay at Sterling Capital, not because I needed to prove anything, but because real change happens from within." The transformation had been remarkable. As Senior Vice President of Global Markets and Chief Diversity Officer, a role Marcus Sterling III had created specifically for her, Amira had implemented mentorship programs, bias training initiatives, and cultural competency workshops that were already being studied by other firms. Patricia Webb's departure had created space for authentic progress, and Marcus's genuine commitment to change had surprised even Amira's most cynical colleagues. "But here's what I want you to remember," she continued, leaning slightly forward, her voice taking on the intimate tone of a conversation with a close friend. "Your identity isn't something to hide or minimize. It's your competitive advantage. When I stopped seeing my hijab as something that made me different and started seeing it as something that made me valuable, everything changed." The applause was thunderous, but Amira's attention was drawn to a young woman in the third row, tears streaming down her face as she clapped. After the presentation, as Amira mingled during the reception, the woman approached nervously. "Ms. Hassan," she said, her voice barely above a whisper, "I'm starting as an analyst at Goldman next month. I've been thinking about not wearing my hijab to work." Amira took the young woman's hands in hers. "What's your name?" "Zara." "Zara, let me tell you what I wish someone had told me. You don't need to make yourself smaller to make others comfortable. Your success will speak for itself, and the right people will see your worth." She smiled warmly. "And if they don't, remember, you might have more power than you think." As the evening wound down, Amira stood by the windows overlooking Times Square, her phone buzzing with congratulatory messages. Tomorrow she would return to Sterling Capital, to the office where her father's portrait now hung, alongside other distinguished clients of the firm. But tonight she was exactly where she belonged, standing tall, authentically herself, and lighting the way for others to follow. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.